Welcome to another episode of The Doctor's Take on Aesthetics. I'm your host, Dr. Josh Wall, Medical Director of Contour Clinics. And with me today, he's returned from the wilderness, Dr. Grant Ross, ladies and gentlemen.
It's a pleasure to be here. Good to be back in the family.
Very good. We've got a very exciting topic today. We're going to talk about complementary health and how that may relate to skin and aesthetics. Now, Dr. Ross is an expert in all things alternative and complementary, health. How do you want to start this one? What do you want to get into first with?
Josh, I want to start with a bit of the story because,
All right.
when people think about integrative medicine, nutritional medicine, alternative, it's everything from crystals to cold ice dunks. There's a really big interpretation of what people think gives us a better way of being healthy.
Cool.
But I want to make it simpler. If we think about two people, one is somebody who lives on a beautiful island, eats fantastic food, organic, is relaxed, sees friends, is a happy, solid, healthy living kind of a person.
Yes.
I want you to contrast them to someone who lives under a bridge and drinking wine every day and chain smoking madly. You're from Wollongong. It's not too hard to imagine.
I've seen it, yes.
In a nutshell, which one is going to look better and feel better?
Well, it goes without saying, doesn't it?
Yep. It's not the wino. So
Yes.
the principle of alternative medicine is about saying, what is it that we put into our body that gives them the things we need? The nutrition, the vitamins, the rest, and the right circumstances to function as healthy as possible and from an aesthetic point of view, look as good as possible.
Yeah. It's interesting you say that because I was thinking about this the other day. And I was,
your bridge?
Yeah, under my bridge with a gut full of wine. I was thinking back to medical school, and I was thinking, how much did we learn about wellness? Like almost nothing. I think we learn as doctors all about pathology, how the body works, but how the body malfunctions in the presence of disease. So it's so interesting to hear about, the health, the wellness. I mean, a lot of doctors will talk about their knowledge of the body, but when it comes to wellness, I don't know if there's any real...
How do you stop a train wreck? So much of medicine is interested when you've met a diagnostic criteria. If someone comes in and says, oh, I'm run down, how often does this translate to the end of the consult going, hey, but your tests and all?
Of course,
so asking the question, does that mean that there's nothing wrong?
Well, I would say probably not. I mean, there's definitely a big difference between surviving and thriving. And I think that's what alternative and complementary or integrative medicine really is. That whole thriving medicine.
100%. It's interesting watching how different people around the world regard this concept. So in Britain, they call it integrative medicine. It's integrated with traditional medicine. In Australia, we tend to refer to it as nutritional and environmental medicine, holistic sometimes. And in America, they often integrate the whole concept to something called anti-aging. But you're bang on about one thing. The concept is, rather than waiting until someone's body dysfunctions so extremely that they have a defined diagnosis, for example, heart disease, high blood pressure, a wound that isn't getting better, obesity, it steps back and asks the question, is this going the wrong way already in order to lead up there? And is there something we can do about it?
Yeah, exactly. I think the body is such a beautiful thing. I mean, we often have such a massive reserve before we actually have some kind of pathological illness. So we're heading down that bad path probably for a long time before we end up with diabetes, before we end up with heart disease, before we end up with that, that coronary event that causes a heart attack. There's a lot of warning signs, a lot of health kind of red flags before that even happens.
And you know what some of the, not just my favorite red flags, but you know what some of the most stark red flags are?
What are they?
It's how you look.
Yes, exactly.
Correct.
Yes.
So if we see someone walking down the road and they're chiseled with muscles, big smile, symmetrical face, like really sort of shiny, healthy looking skin, full head of hair, you're thinking to yourself, you've got a pretty good set of health on you at the moment. For whatever reason, your diet, your lifestyle is going well. And one of the things that I think brings people into the cosmetic world, let's start at some of the obvious things, the contour of the skin.
Yes.
Is this a smooth layer of skin that's shiny and moisturizes itself well? Or are we starting to see some minor things? Blemishes, outbreaks, cracks, dryness?
Yes.
All of those actually have a lot to do with something that we might not say in the end, this is a disease. But if we really look down and think about it, there's that question, are you getting enough of certain kinds of nutrition? Are you having too much sugar?
Yeah.
Is there something else we could optimize in how your body heals itself from the inside? The function of the liver, the gut, your recovery, your sleep, your general wellness.
Yeah.
If you got that right, you would look better. And the best example I have of this is when people come back from a holiday.
Yes.
What is it when they're going to somewhere that has available food? We have that here too. But after 2 to 3 weeks of slowing it down, eating when their body wants to, often getting out and about in fresh air,
Yeah.
they generally come back looking better.
They do, yeah,
Unless
exactly.
it's a bucks party or something. Depends on the destination.
Exactly. So look, if I come into you, so I know you're a cosmetic physician and integrative physician. What if my presenting complaint, putting aside any obvious cosmetic defects, I look tired, I've got dark circles. I mean, what's your approach to
100%.
diagnosing my affliction?
There's so many places to start, but I think in the chair in the cosmetic world, when I'm seeing someone from a cosmetic point of view, we'll certainly discuss in a roundabout term. We'll begin the conversation by saying there's 2 sides to this.
Yes.
One is a bunch of things that we are going to do. We're going to think about, once again, let's talk cosmetics. We're going to talk about collagen resurfacing, volume, and we've got a range of different technologies and treatments. Some are better for others, etc.
Yeah.
For example, I'm going in for Morpheus tomorrow, as we've discussed, and with the CO2 later on. The other half is to say to somebody, this seems to be bothering you. What is your lifestyle like? Is this something that's relatively new for you? Have you noticed it since taking a new job, since having a new life experience? Has something changed in the background? And exploring that a little bit. Some people will be pretty keen to explore that. And I understand why, because the logic is the better you do to get your skin health as good as possible from nutrition and lifestyle, probably the longer lasting will be your cosmetic interventions.
Yes.
The better your recovery and the less you will need.
Yeah, look, that's a very good point. I mean, a lot of these treatments for collagen stimulating, they require your body to heal. And if your body's not in a proper functional state, then it's not going to heal as well. You're not going to get the same results that you would get otherwise. So I think the kind of general health seems very, very important.
Yes, it is. And some of the cases that come to mind, we talk about vitamin C, a very common vitamin.
Yes.
It's used as a preservative in food, so it's very rare that we're deficient in it. However, there's a specific gut condition where sometimes somebody has a bit too much of the wrong kind of bacteria in their gut.
Yeah.
Sometimes that comes out as irritable bowel syndrome, or it's just something lurking and non-specific.
Yeah.
Some people will say when I eat chocolate or a certain food, Coca-Cola, I break out in blemishes or feel bad, lactose, you name it. There's that world of stuff. There's a kind of gut issue there that has a lot to do with vitamin C being used up far more than it should be. Our liver protects itself from getting rid of other things in our body. It just releases all these chemicals to trash it, whether it's leftover hormones, plastics, preservatives, you name it. Natural waste has to go through the liver.
Yeah.
But the liver will protect itself using antioxidants. Rule of thumb here is if you've got too many toxins going in, you overwhelm that system.
Yes.
Or you put too many toxins in, or you're not putting enough of the vitamins that detoxify.
Yeah.
You will chew up your vitamin C.
Yeah.
And one thing we know about vitamin C has a huge role to play with collagen.
Definitely, yeah.
And that'll manifest with those people who just look so full of collagen and thick, beautiful skin, and those who say, it just takes me long to recover.
Yeah.
An extreme example would be diabetics. Here you have a whole range of reasons that their blood flow, their cells, their building molecules, a whole bunch of things are just not quite optimal. And as we know from our medical days in hospital and serious procedures, they definitely recover a lot.
No, they heal terribly, absolutely terribly. Because all that sugar just binds to all of their cells in the body. I mean, that's how we test for long-term glucose levels in the blood, is how much glucose is actually bound to the hemoglobin molecule.
Yes.
And yeah, it just really affects healing, doesn't it?
Yeah. So each person might have a different reason for why they're not healing well, or their skin is not naturally healing well. If we go into the sun at the end of the day, our body will have a reason to say, okay, there's a bit of damage from the sun.
Yeah.
Overnight, we're going to repair it. But there are always that people who don't repair as well as others.
Of course.
Particularly in Australia where the UV level is high and you see people with so much more photo damage over time, such as smokers.
Exactly. So, I mean, look, the first easy things are stop smoking first. Alcohol. How does alcohol affect, the health in a general way?
It's bad for you, would be the short answer. There's a lot of research being bandied around about how much alcohol is bad or not bad. And I think what we can say is that if you have good quality organic alcohol, it doesn't have too many chemical things in it, not the stuff you drink, but if you're having a little bit of that every day, it's neither here nor there. And we know that red wine has resveratrol and sirtuins and antioxidants in it. Even a good German beer, for example, is prebiotic. It's potentially good for our gut.
Yeah.
Go over that.
What is a prebiotic?
Prebiotic is something you feed your good bacteria in your gut. Roughage, vegetables, anything like that. I mean, if you just for a moment imagine someone who just eats McDonald's versus someone who has vegetables, a lot of the reason they feel and look different after a while is the health of those good bacteria. And they do a lot of heavy lifting. They detoxify things you want out.
Yes.
They also produce a lot of B12 and other vitamins that, going back to skin, are so essential. Skin is one of the biggest organs in the body, and it
Definitely
really needs to soak up a lot of nutrients and energy molecules to repair those layers so that they look shiny and nice and smooth.
Absolutely. I mean, look, I think probably one of the better things you can do for yourself aesthetically is just live a healthy lifestyle. So exercise. I think the other thing that's really underthought about sleep. I think sleep's a very, very big thing.
Sleep is probably one of the biggest modifiable health risk factors in every sense. But looking at cosmetics, once again, that person who's been on holiday, they said no to that 11 o'clock phone call from their boss. They said no to that extra drink session lasting till 3 a.m. that carried on the whole night.
Yes.
They made a point of getting a good 8 to 9 hours of downtime. And
Makes a big difference. Absolutely.
You're lying flat, your lymphatics and all that fluid under your eyes will drain out of the way.
Yeah.
But think about all the other benefits, which is that if you're not out there trashing your body with alcohol and all kinds of things like that, less of those toxins are in the body. And there are 3 ways the toxins leave the body: the urine, stool, and sweat. So, when you've had a big session or you've been at some party and you drank maybe not the highest quality alcohol and you just feel like you're sweating it for days after.
Yeah. That's what it is.
That if you aren't walking around with a hungover kind of a body, your cells are going to divert all the energy they would take to deal with that problem into the regeneration of skin cells, muscles, joints, all the good stuff that keep you looking and feeling good.
Yeah, wow. So what would be a good place to start? Say I come to you, I've been trashing my body for years, eating McDonald's every day.
Evidently.
Drinking my cheap booze.
Yep, under your bridge.
Under my bridge. Where would I start?
Yeah, there's a range of ways. The first place is with the big obvious lifestyle things I think we all know. Eating vegetables, having less food if you're eating too much, not having too many foods that come from a packet.
Okay. What do you think about calorie counting? Is that
I'm controversial moment.
Oh, yeah.
Here
we go. Yeah, sure.
I hate calorie counting.
Why?
And I hate macro.
Do you?
Because the whole thing is bizarre. It's like saying, here's a car and we're going to put the steering wheel in the glove box and the wheels on the top. Yes, you technically have all the things you need, but they're not in the right place.
All right.
Josh, our gut is 7.5 meters between our mouth and our butt.
Yeah.
Of evolved organ to take in all kinds of things from a forest or jungle environment. That's where we're from.
Yeah.
And we take in little bits of bacteria from plants that tell us how do we break down that plant and get rid of nasty invading things.
Yeah.
We start to change things. We get food from a packet. It's got a lot more salt, a lot more preservative. It's got a lot less roughage. And it doesn't have all those beautiful chemicals you get from plants, flavonoids, natural antioxidants, things that are antimicrobial. So we think about a whole bunch of things, like even tea bags, for example. We know that they've got antimicrobial effect. Green tea has profound anti-cancer qualities about it because of the nature in which it gets rid of things that our body doesn't want.
Yeah.
So we're eating a diet that has a lot of packaged foods, things from McDonald's. We're not getting that good roughage. And that's the easiest place to start. I heard a statistic once, don't quote me on it, but I think that it's really, really hard for vegans to be overweight.
Interesting. Is that due to their gut bacteria?
Yep. these people are eating foods that are naturally low in calorie, high in nutrition, and they take up space in your stomach.
Yes.
And they don't feed bad bacteria. So if you are eating a lot of vegetables as a basic premise of your diet, you're really unlikely to get fat and unhealthy.
Yeah, interesting.
Someone who does it. On the flip side,
Yes.
as you know, I've come back from working in a remote area. When you're out there, and a lot of people will know this, but if you're working on the mines on an oil rig or something, and you've got limited options for the food they can get into this place, you often gain weight. You remember night shift where
the worst.
you'd have your mee goreng and whatever crap you found in the fridge, and we're all
the
there.
vending machine.
The vending machine lifestyle. Middle of the night as you're trying to ignore
So
the pager.
not healthy those first few years as a doctor.
No.
It's the least healthy job you could have, I think.
I know. And then what happens to everybody we know later on when they kind of like retire or get married and all of a sudden they've got good healthy food? They lose weight and they look better.
Exactly.
Yeah.
Yeah.
So diet, great place to start. You mentioned sleep before. I think this is an easy place to start.
Definitely.
Those are two things. To get a bit nerdier though,
Yeah.
or to go into some serious questioning,
Yeah.
there are some key vitamins that tend to be lower in our population than what they used to be, and we know they're ones that can be low. And I'm thinking of vitamin D from the sun, acts like a
Yes.
hormone, very important for skin, bones, joints, and mental health. A whole raft.
Very interesting one, that one, because if you think about it in terms of aesthetics and, sun protection and skin safety, I mean, it's a hard one to kind of judge how much you get. What are the recommendations around how much sun I should get?
Yeah, really good question. One of the funny things about vitamin D is you can't absorb it if the light comes through a window or bounces off a building. It has to be direct sunlight.
Yeah.
But for someone as pale as me, frankly, 20 minutes of having a bit of exposure over the neck and the arms is generally considered sort of adequate.
Yeah, okay.
So you don't need to go out and roast yourself just on the off chance, and you will still get some vitamin D absorption through sun cream.
Yeah.
But for some reason, despite people doing that, they might be doing long hours in an office, they don't get the chance. It's regular exposure to sunlight. The levels will still be low.
Yes.
And that's where we flip and we get a bit more medical and we say, yeah, get it, you can eat well, avoid junk food, climb a mountain 10 times a day, sleep, go and retire. You can maximize what you can do.
Yeah.
It comes a point I really believe that sometimes you want to do the blood tests.
Okay.
You go a bit further and you say, I want to look into this. What is my B12? Biggest vitamin in the body by size and in amount that's used. So alcohol, for example, a night on the piss will take a lot of B12 out of your system.
Yeah, interesting.
That's where the hangover is.
Interesting. How does that happen?
You've got the chemical from alcohol swanning around as the leftover, interrupting how your brain functions.
Yeah.
But in order to get rid of all of that toxin, your liver is working overtime and dries out something called your glutathione.
Okay.
Now, you in cosmetics would have heard of glutathione from the skin whitening
Yes.
point of view.
Yeah, yeah.
People love glutathione because it's the master antioxidant. In Asia, it is widely sold for skin whitening
Yes.
as an infusion, but also for the contour of the skin as well. And it's one of those things alongside niacinamide. Let's face it, we can't have a cosmetic chat without talking about niacinamide
Exactly.
for the contour of the skin. And what we mean by that is niacinamide and glutathione help cells repair by giving them energy to repair. And what we see is with glutathione, people have shorter hangovers, but they tend to have a bit more of a glow in their skin. And as we know with niacinamide, it turns up in a lot of eye serums and
Yeah, very anti-inflammatory.
anti-inflammatory, tends to have an impact on the contour, I take
Yeah.
it.
Yeah.
But what it does is it helps something called the mitochondria, the cell repair thing, to fire up a bit more and work better. And what's an interesting thing, you might have read this,
Yeah.
people who are on niacinamide 500 milligrams a day have something like at least 40% lower chance of non-melanoma skin cancer.
Wow. I didn't know that.
Yeah, it also lowers your cholesterol if you're taking it.
Crazy. That's wild. Yeah.
So I put everybody on it who's half interested in that question, which is, I'm going to get a bit of laser or I'm going to get Morpheus or microneedling. I'm going to do some resurfacing work.
Yeah.
But you know what? I'm kind of at risk of skin cancer. I go on the booze from time to time. And then I just think to myself as an integrative medicine practitioner, is niacinamide right for you?
Yes.
Are we going to find that your skin is just a bit happier, tighter, cleaner for a longer period of time? And then you sustain those gains that you get from the procedure that ultimately you're going to have.
Yeah, nice one. Cool. Yeah, niacinamide is very, very big in all kinds of skincare ranges.
Do you use it much? Do you recommend it? Or?
Yeah, for its anti-inflammatory and it's very good for inflammatory skin conditions like rosacea, other kinds of dermatitis are very, very effective, can really reduce inflammation. Inflammation's a really important one for facial aesthetics, especially people who have significant inflammatory conditions like autoimmune condition. We see they waste from their face a lot. So, and one of the hallmarks of facial aging is a loss of fat in the face.
Yes.
So, and inflammation will cause a big loss of fat in the face. I mean, I've had patients before, they come and see me for a few years, and then they have some kind of life-threatening illness that puts them in ICU for a few weeks, and it'll just rob them of all their facial fat. It's really wild to see, actually.
It makes them look like one of the Rolling Stones.
Yes,
Extreme illness.
Exactly.
Is going to use up fat reserves.
Yeah, it's wild.
But you talk about inflammation is interesting when we talk about diabetes. So I'll tell you what, do you want to just explain in real easy terms, what is inflammation for people out there?
Well, I mean, that's a hard one for me to explain, I think. What is inflammation?
When the body gets angry because something's wrong.
Yeah, well, I was thinking for some kind of medical explanation there, but that's probably even
Rubor,
better.
color, dolor.
Yes.
Sure. When there's an injury or an insult and it's that reaction, it's the redness, the swelling, it's saying, hey, there's something wrong.
Yes.
Let's go into a defensive mode.
Yeah.
Switch the flow of things, but also let's flood it with swelling and panic.
Yeah.
But at a cell level in integrative, I call it hippie medicine. I'm proud to be in that. Don't look like it, but anyone for Jarrah, it's there. But in hippie medicine, we are interested in information because what it tells us is something somewhere in the chain of events is leading your body to be not happy and think it's in panic. And that can be something we can recognize. A hangover. You've just done an 8-hour hike or you've had surgery. We know why you're unwell. Illness, a cold or flu.
Yeah.
But then there's that moment that you think to yourself, you don't look great. You're not recovering from this cold.
Yeah.
What your cells are doing is that they're saying, I'm still switched on, something is wrong.
Yeah.
And they divert their energy to fighting and defending rather than repairing those deep, highly metabolically active fat pads just above the bone structures in the face that give that tenting volume to how people look.
Yeah.
And you're right about that. If we think about just really out there, straightforward, serious illness, cancer, hormone issues, etc., even anorexia nervosa, things like that, the hollowness is just abundantly clear. But then there's someone on the line and you think, you've got enough calories, you've got probably enough fat in your diet, but as an integrative guy, I'm thinking, is it getting absorbed? Is that gut really picking up all those nutrients?
Yeah, interesting.
And are we using all those nutrients to get rid of some other toxin in the body that's just, why aren't we laying down more bricks and mortar where it counts in the face?
Yeah, cool. So you do a panel of blood tests first. So, I mean, you first look at the lifestyle factors. They sleeping, stress, exercise, smoking, alcohol, all the stuff that you should just getting the basics right first.
Yes.
You got the basics right, and then we think, let's do some blood tests. So you've mentioned a few of the blood tests you would do, so B12 being one of them. What other kind of standard ones would you do typically?
I like to start with a certain group because, as a doctor over the years, you don't quite have exactly a reason, but you've got a memory for a reason. So I find common things occur in bundles. I'm interested in what's going on with the liver.
Yeah.
I'm particularly interested in that because if your liver's got enzymes and they are saying, hey, we're doing normal liver things, we're working this hard.
Yes.
When you get the blood test back and it's working this hard, you're thinking to yourself, why? Okay, diet's one thing. Have they got the wrong kind of bacteria in there that's just sitting there doing really well, eating their food, and in return, rather than giving them good nutrition and anti-inflammatory chemicals, it's just spitting out toxins. Candida comes to mind.
Okay.
It's a yeast. It tends to live in the gut of all of us from time to time. But if there's more of it and it gains a foothold, it tends to make people crave sugar.
Interesting.
It also gives it some acne over the chin.
Okay.
And sometimes redness around the nose. And you often see that in females.
Okay.
That's not to say that every time you see that therefore it must be Candida.
Yeah.
But what we do know is that this Candida releases these chemicals and they do change somebody's sense of taste and food cravings.
Wow.
An extreme version is in some children, I've noticed, particularly with behavioural issues, that they have a huge preference for carbohydrates. Chicken nuggets or sugar or things like that. And then the behaviour is linked to it. Once again, I'm not tying this to some concrete, it must be.
Yeah, they're just clues, aren't they?
They are clues about the pathway that's going on.
Yeah.
So that that opens things up for somebody who has really good nutrition in terms of the food in front of them. But this question remains, is it getting absorbed? Is it getting stolen or used up by bad bacteria? Or is there something else that causes your liver to chew through it?
Yeah, cool.
So you get these miracle moments that you do a blood test on somebody who's got fantastic from the outside nutrition. And I want to look at a few things. B12 is one of them.
Yeah.
Vitamin D is kind of one of them.
Yeah.
Folate is another one.
Yeah.
Liver enzymes. Iodine, an important mineral for thyroid, one of our metabolic hormones.
Yes.
And I also want to have a look at their iron stores. When the body is in distress, it takes a lot of iron out and hides it away in the liver
Okay.
because it doesn't want that iron to be freely available for an invading bacteria. It does the same with copper.
Yeah, okay.
And that pushes up a blood test number called the ferritin. And if that becomes exaggerated for a really long period of time, somebody's fighting a war with a gut bacteria, their diet's a bit poor, their iron's living in their liver, over time, the liver doesn't like that and it gets inflamed and that starts to look like fatty liver.
Okay.
A lot of people are told, oh, you have fatty liver, but what is it? And we know that if we put someone on vitamin B12 and give them more dietary fibre and a higher vegetable content and reduce alcohol, we know that that helps reduce fatty liver in a dramatic sense.
Interesting.
So we look at vitamins, we look at the liver together to build up a bit of a picture on how those things are going.
Yeah, cool. And then say you do find a vitamin deficiency, is it just as simple as supplementing?
Usually. Most of the time for common vitamins that people in Australia tend to be deficient in, we kind of know why. So for example, if someone's drinking a lot from time to time and their vegetable intake isn't great, and one or two other factors, and we find a low-end B12, we're not too surprised by that. And there are a few ways to get B12 in the body.
Yeah.
Sometimes you can just inject it straight away. It works. We know it works. There are versions of it that you can swallow, but they have to be the right product at the right time to get in.
Not very bioavailable, are they? You're not going to absorb much of that orally, are you?
No, and often a lot of the B vitamin series are put with other B vitamins in replacement form. So you take it and then your urine goes a brighter colour because
Just expensive urine.
it's expensive urine, but how much is getting in? And some of it will be getting in, there's all of it getting in. You don't know till you repeat the blood test.
Interesting. And then I guess for some of these people, they've got a gut that's not functioning optimally either. So the absorption of those vitamins is probably going to be a little bit more impaired.
Oh, more than a little bit impaired. I don't think you and I would ever anticipate sitting down here talking about irritable bowel syndrome in the cosmetics lab.
But look, it's so important. I mean, like you said, the skin is one of the largest, if not the largest organ in the body.
Yep.
And it's a surrogate for general health. I mean, you can tell when someone, you can't be really unwell internally and it not manifest in your skin. It's very obvious often when someone's unwell.
Do you know what often bothers people the most is bloating? And
Yes.
the permanent feeling of, I've got this. And
Yeah.
it's not an apron of fat that's clearly on the outside. We know it from cosmetic background that, fat's here and then behind that's the abdomen. And it's got this gaseous thing. Do you often sort of find people that have come in and said, oh, I'm worried about the fat.
Yeah, of course.
I'm going to do this and that, but actually there's substantial.
Well, they might have veins in their belly.
Yes.
So there's no subcutaneous fat at all.
So
they're
that's
a bit
very
bloated.
good sign, they've got bloating, and so from that point of view, the gut health, we end up swinging back there in a lot of instances because for a lot of people, it can fly under the radar.
Yeah.
For a really long time. They think, I'm dieting like hell. I'm starving myself, crazy, and I'm doing everything right. I still have this bloating. And
Yeah, it can really mess people's heads up.
And so one of the things I enjoyed about sort of being an integrative guy and then heading into the cosmetics is that there was a zone there that you had a moment that you felt, actually, I think that is gut. And you'd say a few things and you'd have a brief chat.
Yes.
You would still go ahead with the cosmetic side of things.
Of course, yeah.
We treat things multidimensionally to get the best outcome. There's no question.
Yeah, it's a good point about that. I mean, a lot of this stuff we'll talk today about getting good general health. But look, sometimes that poor general health has led to a cosmetic issue with the face that we can replace with filler, with collagen stimulators. We can maybe touch on those very briefly. You said you were going to get Morpheus. Morpheus is a radiofrequency skin needling device. If anyone's ever had skin needling before, this is like skin needling on steroids. It's got like a current that goes through between the pins and causes an intensive collagen stimulation. And they're things that can help to fix some of the issues that we've had from, inflammation, from just general aging as well, from not looking after ourselves in our youth. That's a very good treatment. So things to stimulate collagen.
The thing, as someone who consumes Morpheus, I swear by it.
Yes.
Absolutely swear by it. I feel like it's an electrified holiday in a handheld device. And it goes in there and it mucks things up. But, the week that you have Morpheus, you feel this recovery and you feel that things are building in structure and that collagen, and it adds volume in a way that is just so global across the face.
Yeah.
But it has a lot to do with that healing of the skin you've got.
Yeah. Look, there's two real paths you can go down in terms of really, these are Band-Aids for a problem that we've had. So Band-Aids for an aging problem. So you can put filler in, or you can do Botox injections or something similar to that. And that can treat the symptom of aging or treat the symptom of poor general health, which is that tired, kind of drawn appearance. But then when you're doing things like the Morpheus, or you're doing collagen stimulating injections, you're actually treating the underlying cause, or you're treating, it's your own tissue.
You are piggybacking on your repair mechanisms to optimize them as they are from when you were built. And there's something nice about that, because instead of intervening at just one tissue layer and leaving all of the others behind, you are going the most natural way possible.
Exactly.
You're getting those cells, you're giving them a slap and saying, off you go. And you can't get better aesthetics than using what you've got from that point of view.
No, exactly. Because we don't have, there's no natural stimulus for your skin to heal in the absence of a trauma or in the absence of some kind of damage to the skin. You need so we do like a controlled damage to the skin with Morpheus, or skin needling, or lasers, the CO2 laser we mentioned before. They all work on the mechanism of a controlled micro damage, and that your body's healing mechanism or response to that trauma is what gives you the result.
Yep.
So if you are to do this, I always look at Hollywood actresses and Hollywood actors. They're in their 80s, they still look like they're in their 30s. It's because they've done this from the age of 30.
That's my plan. It's true. We think about the celebrities. They are not just having one or two cosmetic procedures randomly.
No.
They will be seeing a personal trainer who knows a bit about diet. And might I say, most personal trainers, I get a lot of referrals from personal trainers.
Yes.
They're in the know, they live and breathe it. You'll never see them any McDonald's, right? But they will help out with diet a lot.
Yeah.
But these celebrities and people who are really keen on this, they're not just saying, oh, I'll have some cosmetic attention from time to time. They'll be having personal training to really get moving and get healthy from that point of view.
Yeah.
But they will have quite a lot of focus on their diet. It might be through a dietitian or nutritionist or from a personal trainer, but they'll be doing a lot of that stuff.
Absolutely.
And they'll piggyback on the top. And, a lot of my patients here came from that camp. We're already seeing dietetics and personal trainer. And I have to say the results from doing both always stand to reason to be much better.
Oh, definitely.
Muscle tone and nutrition and everything is good.
Yes.
And then you can go in and say, well, okay, we've come so far along this line. Now what we do next is adding to how well I've got my body to heal itself.
Yeah. Yeah, there's only so far you can go with. Look, I think it's probably the biggest thing you can do for your general aesthetic is the diet and exercise, stopping drinking, smoking. The sleep, I think, is probably one of the biggest ones. But then you get to a point where you've lost some facial fat. Your skin doesn't have the same tautness. It's lost a bit of laxity. Mm-hmm. Your skin doesn't have that kind of luminosity that it had when it was younger. So they're all things we can step in then with that healthy kind of organism and heal much quicker.
And can you imagine too, from my cosmetic side, I think, if we're going down the pathway of putting in, can I say brand names? Is that a thing? If I'm putting in a collagen product that helps stimulate collagen,
yes,
we're going down the pathway of some laser or some Morpheus.
Yes.
And all of those things, and I'm thinking to myself, I'm going in there and pushing, but how well is the response going to be better if we had all these other factors? So you just kind of get a sense of that person who's in pretty good health and like, I kind of know we're going to have a really, really good outcome here.
Yeah, definitely. Yeah. I think it's, I think you probably have a slightly lower risk of complication as well from that. If you think about even the risk of infection, if you're young, fit and healthy, your chance of infection, your body is just so much more primed to handle potential insult from a bacteria that was sitting on your skin anyway. And we call them opportunistic infections. Our whole body's covered in bacteria usually. And we do clean it down with some antiseptic solutions beforehand, but you'll still have a couple around.
Yes, you will.
And if you are in good shape or your body's healthy and your immune system's healthy, it's not fighting off some other rubbish that you've got going on.
Well, talking about hair transplants, for example, when I train in that area, speaking to a lot of the established hair transplant doctors, a lot of them would say that for certain patients who had said, I'm a bit run down or it's not going so well, they would often start a multivitamin or vitamin C for 2 weeks beforehand.
Interesting.
And their attitude was, actually, I just feel this push you into a better state of recovery.
Yeah.
So things are going to be a lot easier on that other side. And then when someone says to you, and this is a general point actually, if you know that you're a person who swells or goes red after a procedure, please bring it up with your practitioner, because it'd be something for us to take into consideration about how we go about things. But if you've got something you can do for a patient who is not recovering as well from anything as they like to do, whether it was some IV infusions or good nutrition, or saying, hey, I tell you what, I'd like you to go, normally I'd say go off alcohol for about 3 or 4 days before a hair transplant. But if someone said to me, I'm being run down, or you think this is going to be a big procedure, I'm inclined to say, you know what, I really recommend 2 weeks here. You
of
get
course.
vegetables, sleep well, and take the weekend off, because I just want to push that body to that position where we've got more room.
You want to be in the best shape possible, and we spoke briefly about reserve before. You want to have your body having a little bit more reserve than usual.
Yes.
Because if you've been burning the candle at both ends, and well, a lot of people, I mean, especially in the big cities, I mean, we live in Sydney here, and everyone, they're working hard, they're doing 12-hour days, and then they're going out with their friends afterwards and drinking and eating poorly, and that's a lot of inflammation, that's a lot of stress, that's a lot of resources your body has to direct towards fighting off and repairing the liver and whatever other rubbish is going on.
And sometimes we've got to use medications, like for bigger procedures, we might use some medications. But there's a little bit of wisdom in that, if someone sort of says to you, oh, I'm going on this really busy business trip for 4 weeks and I'm going to come straight from the airport and do 5 cosmetic things at once. If they're really hardy, you might be like, you'll have a great time. But on the other hand, if you're like, there's something nice to say, just put a day in between it.
Yeah, exactly.
Yeah, you'll feel better, you'll recover better, you're kind of in the right zone to do it.
Yeah, especially with some of the more invasive, aggressive treatments. Because we know in this space, the more invasive, the more aggressive, usually the better the result.
Yes.
So we have a little bit more downtime, and if you do get yourself in that space, even in terms of lowering your stress levels, like I've been wearing this, it's called a Whoop, it's a fitness tracker.
Aha.
Yeah, it's not jewelry, it's not fashion, it's not fashion. Well, it's tracking my poor performance at the moment. But what it shows me is something called a heart rate variability. I don't know if you know much about that. Can you explain?
Let's get proper nerdy. So our heart beats so many times per minute, and throughout the course of the day, sometimes it'll want to beat faster.
Yes.
Sometimes it'll slow down.
Yeah.
And that's because we've got sets of nerves in our body that yank it to go to a bit more of an alarm state, the sympathetic nervous system, fight, survive, that kind of thing.
Yeah.
The really relaxed parasympathetic, digest, make love, relax, sleep, all those kinds of things. It's normal throughout the course of the day for there to be a certain amount of variability up, down. One of the funny things about inflammation, whether it's because you've got vitamin D or B12, zinc deficiency, too much macas, under the bridge, you don't like the jog, something's wrong, the inflammation sends out a bit of a, hey, we're in trouble signal to those nerves.
Yes.
So they're not pulling as extremely one way or the other.
Yeah.
You know when you meet that kind of really high-strung person?
Yes.
And their mood's just sort of tensely in the middle?
Yeah.
Our hearts don't do that. They go up and down to have a range of settings.
Yes.
So if someone has a narrowed heart rate variability, we're thinking about whether something else is bubbling along, stringing their nerves about, and that changes how easily they relax, how their heart moves, and their heart rate. So it's a surrogate for something else going on in the body.
Yeah, it's very, very interesting, because I find that mine will, if I get really great sleep and have a good sleep score, then my heart rate variability go up.
Yep.
The heart's ability to respond is much better. But I've found even things like stress. I might not even do exercise. I might just have a very stressful few days and my heart rate variability is in the toilet.
It is profound. Like if you think of those moments that you were high-strung and bored, or just the other thing, concentration.
Yes.
As you meet someone as a patient or a friend or whatever, and they're just kind of not there. And and this is where it comes to the sensibility. Reading between the tea leaves here, there's an element of, is everything great, or do you need a few more days to rest up, take a few days out of work?
Yeah.
And then we'll talk about a more overall plan. So, when the body's happy, the nerves are happy, the heart rate's happy.
We'll just talk a little bit about sleep and its impact on aesthetics and just general health in and of itself. Tell us a little bit about sleep. I mean, if I come into you and I'm like, I've got really dark circles, and what would you suggest to me if I'm saying my sleep's just bad?
Oh, well, the first thing is are we talking about something that you've had a rough couple of months and you've got bags under your eyes, and really a good sleep is the place to start? Or
Yes.
Are we talking about a long-term eye bag issue that sleep probably doesn't have a huge amount to do with it?
Yeah,
We're
fair
swimming
enough.
cosmetics.
Yeah.
But if we're going on sleep, we're asking the question, are you staying up late at night doing work, hitting the screens, having arguments with your neighbour? Or have you got some idea in your mind that at a certain point in the evening, switch off?
Yes.
You know it's important, you believe it's important.
Yeah.
That's your downtime.
Yeah.
You recognise that that's what's important.
So that just normal sleep hygiene kind of stuff.
Sleep
So,
hygiene.
I mean, look, if you want to be real strict with it, I mean, you talk about going to bed at exactly the same time, within 20 minutes each night. I mean, with all of our busy lives, it can be hard sometimes, but it's something really worth investing in. You mentioned about the screens as well.
Yeah.
How long would you say before going to sleep with screens?
I think you probably want a few hours, because if we think about how sleep works, throughout the course of the day, our body chalks up hormonal changes that eventually hit the brain and say, we're winding down.
Yes.
One of them is the sun going down.
Yeah.
The other one is the temperature dropping a little bit.
Yeah.
And the third one is that noise settles down, stimulation settles down.
Yes.
In my past life, in chunks of military training, I've been
Yes.
out in the field. You notice very quickly that the lights and the stimulation settle down.
Yes.
You want to recreate that. You want some predictability. So at 10:30, 11, whatever works for you,
Yeah.
TVs off, screens off, noise down, we're not answering emails, and the regularity of going to the bed at a particular time as well. Your brain is going to snowball into the, hey, it's nighttime chemistry.
Yes.
And what happens at nighttime is that one of our alert awake hormones, cortisols, will really seriously go down.
Yeah.
And then melatonin, one of our sleep hormones, will start to go up. If we interrupt that with alcohol, partying, being out, stimulation, we don't sink fully into sleep. And here's the catch. Like, this is when we go to sleep and we fully get into it,
Yeah.
our brain releases a chemical called brain-derived neurotrophic factor.
Okay.
So, for once, medicine has named a hormone clearly. Because what it does is it washes around and makes your brain recover better.
Interesting. Yeah.
Not just your brain, a whole bunch of cells that clean up that fluid under your eyes and that startled look and the dryness, and your immune system. So all of that, how good is
That's why it's very, very helpful to have a good sleep. You'd mentioned, one of the things, the light goes down. I mean, the importance of blocking out all the lights in your room is one thing. You mentioned another thing, and it leads me to the coolest thing I've just bought. It's the lowering of the temperature. So I've got this new cover now, and I've got no affiliation to this product at all. It's called 8 Sleep.
Not yet.
Yeah, not yet, but if you're out there, 8 Sleep, hit me up. No, it's a mattress cover, and what it does, it regulates your body temperature. So it actually senses what your body temperature is and will adjust the temperature of your mattress to keep your body temperature at an evidence-based level for sleep. So it knows that your body temperature needs to drop slightly to dip into sleep. So it'll make your body temperature drop slightly. And then as you go through the night, the mattress will slowly warm up in the morning to wake you up. The other thing that's quite cool about it is that it actually will do heart rate variability, respiratory rate, heart rate. It gives you all these sensors, so it links to your phone. And the other thing it can do is quite cool. I mean, I'm sleep next to my fiance, and I get up a lot earlier than her, so using my phone alarm, well, this actually has a vibratory alarm that only goes on my side.
Does it kick you onto the floor?
No, it doesn't. So, and you know how I knew this thing was like the thing I needed to buy, is that guys like Elon Musk and Mark Zuckerberg were promoting it. Now, these guys, they're not influencers. They got billions of dollars in the bank. You can't pay them enough to promote something. So when such high-performing individuals are getting behind something, you think, yeah, this probably has. And look, there's a lot of really good science for it.
There is a hell of a lot of science for it. I mean, even if we go back to pre-tech ages, what did people do? They had a holiday house. They had a place they went to, like literally catch up on sleep in those optimal conditions.
Yeah.
So taking it seriously and just getting that replenishment. And I'm not surprised because temperature control is a big reason people have rubbish sleep.
Definitely.
Back in our GP days, how many times people say, I couldn't sleep properly, the room was too hot or something.
Yeah.
So, you know, even to modify those factors in some way, like you can't underestimate how important sleep is for your health, but like seriously, you can't underestimate how good your sleep is for looking good.
Oh, it's
Like, we can do
what's
a lot with the
essential.
zombie, but sleep is probably better than a lot of the cosmetic procedures.
I would say it's better than most things we can do cosmetically.
Yep.
I mean, look, there's only so much you can do for hollowness and loss of facial fat, but if you want to do something to change your look very, very quickly, I mean, if you can just try and get your sleep score, if you like, you want to invest in your sleep, that's going to be the best thing for your aesthetic. I mean, people are going to know. I mean, what do people say to you when you look good? You look well rested.
You look well rested.
You know, like that's
you're really bright and shiny. And you know, when you come back from holiday and you feel really good as well.
Yeah, definitely.
It takes you a few weeks to start being a bit of an ass again. Washes out. But reality, that's what this is about.
And some less than others.
Oh, wouldn't be us. If you can recreate that chunk of sleep and you go home and you know that you're switching on your blanket that you've got here with your temperature control, whatever it is that works for you. You might have a favorite room of the house, whatever.
Yes.
If your ritual works, you are so going to get something out of it.
No, definitely. Cool. All right, man. It's been a very, very cool talk today.
Off label?
Yeah, a little bit.
Have to celebrate all that talk.
Sure.
It's rich.
I'm sure you'd know the good ones around here.
My drink is organic. It's got perfectly organic red wine and some kombucha.
Kombucha, great.
It's the healthiest, youngest drink.
Very good. Thanks for listening, guys. This has been another episode of The Doctor's Take on Aesthetics. We'll see you next time.